trying times. Um, we had two speakers listed for today, but unfortunately, we did get a message from Dr. Dyer this morning that she had a family emergency, so she won't be able to join us today. We hope she's well, and we'll get her back for a makeup session soon. So we'll have a little bit more time, if needed, for Dr. Moody. Um, really excited to introduce Dr. Moody. Dr. Moody is a clinical psychologist with expertise in syndemic approaches to health, focusing on how multiple epidemics are driven by social inequities and environmental hardships, and how they interact to increase the burden of disease. His research aims to identify biopsychosocial determinants of sexual minority health and to develop interventions that reduce health disparities by addressing vulnerabilities and promoting resilience within this population. So before I hand it over to Dr. Moody, just want to encourage everybody to put questions in the chat, and I'll try to moderate and bring up questions that are relevant as needed. You can also wait till the end of the presentation and ask then. Again, we'll have a little bit more time for questions at the end. So with that, I'm happy to hand it over to Dr. Moody.
Thank you. Share my screen and start the presentation. Can you see the slide? Yeah.
Yes.
Great. All right. So thank you for the invitation, and it's nice to be with you all today. Given everything that's going on and so much uncertainty, it's just nice to be reminded that although challenging, I'm surrounded by a lot of people who are just very dedicated, and regardless of the difficult path ahead. And so it's just nice to be among community right now. But so I'm going to talk to you just briefly about some of my research that focuses on substance use disparities, taking a more of an intersectional approach to understanding these disparities. So it's just a couple quick studies that I've done, and then I was going to just spend a little bit of time talking about kind of some of my planned upcoming research that hopefully some of you will find interesting, and maybe at some point we could collaborate. So I'll tell you a little bit more about me and how I got here. I'll highlight two studies are recent studies that focus on disparities in alcohol and drug use consequences at the intersection of sexual identity, gender, and race ethnicity. And then, as I said, talk about some of the upcoming research that I have going on as part of my K. And then, we'll have a discussion or questions or whatever we can do in the time that we have left. So just briefly about me. I did my undergrad at the University of Arizona. I was desperate for some course credit to wrap up my degree. And so I went to Dr. Stephen Russell's office and begged him for a research assistantship. And he was gracious enough to give me to let me work on a study of his that focused on adopting enumerated legislation regarding in anti-bullying laws and to protect sexual and gender minority youth in schools. And so that was like my entry into research. And then I worked with Stephen for a couple of years after that on some research focused on suicide among sexual and gender minority youth before going on to grad school, where I did my training and moving to New York so I could do my training there, and trained in health psychology and political science. And so, and I'm a clinical psychologist by training, so I did a year of internship at the Ohio State University. It's one of those schools where you have to say "the" beforehand. And so I spent a year in Ohio and then moved back to New York for my postdoc at Columbia University. It was a T32 fellowship in substance abuse epidemiology. And so I was there for a few years, working on kind of expanding my kind of analytical skills in more public health domains. And then recently, in 2023, I started my faculty position at the University of Connecticut. I am here with Ryan Watson, who I actually met back when Ryan was a student of Stevens, a grad student of Stevens. And so we've come full circle, and Ryan and I see each other pretty frequently again because we work in the same building. Um, so yeah, so it's really nice whenever you never know kind of the connections you're going to make and like how long, where those connections will go. Ryan and I are really great friends. And I consider Stephen a great friend and colleague as well. Um, but yeah, so I've been at UConn since 2023 as an assistant professor. And a lot of my research is focused, I guess the overarching kind of goal of my research is really to advance health equity for minoritized populations in the United States, with an emphasis on sexual minorities who live at the intersection of multiple forms of marginalization. And so really there's three kind of like sub-aims across like in terms of that is looking at structural and social determinants of health inequities, looking at psychological and social and biological mechanisms that might link those structural and social stressors to health consequences or health outcomes. And then eventually developing interventions to address these vulnerabilities and promote resilience in these critical and important populations. So, uh, just as well, I guess, given since I had thought I had about 20, 25 minutes today, so I was going to just highlight two studies that focus kind of the on substance use. But a lot of my research is, I guess, when I went to grad school, I was working in an HIV research center, and so a lot of my research started to focus on. I'm primarily interested in drug use research, but under the umbrella of HIV research. And so as a result, prior to like while I was in grad school, a lot of my research focused on sexual minority men. And definitely understanding about how the disparities that exist within sexual minority men in terms of drug use and HIV vulnerability. We know that Black and Hispanic sexual minority men bear a disproportionate burden of those health-related outcomes. And so, but as I've been looking at this literature more in depth, I noticed that there are some inconsistencies in terms of uh, how whether or not a disparity actually exists in terms of drug use, how big that disparity is. And so um, I think one of the limitations is that a lot of the research that's been done has focused on just looking at differences within isolated identity categories. And so I've been trying to just become more adept with uh, quantitative approaches to intersectional, to kind of examining drug use and other health behaviors with an intersectional framework. And so the two studies I will present today are looking at the sexual identity, gender, and race ethnicity, and really using those identity markers as proxies for experiences of the stigma and oppression that come along with having those minoritized identities or marginalized identities. So the two studies I'm presenting to you today come from the same data set. So I was just going to I provide this slide just to give you an overview. It's from the National Survey on Drug Use and Health from the 2015 to 2019 waves. And the NISD is a national representative sample of U.S. civilian populations, ages 12 and over. It's conducted face-to-face household interviews as well as like a computer-assisted survey. And then the survey responses are weighted. There's about a 64, somewhere between 64 and 67% response rate across years. The challenge with the NISDO, there's lots of challenges with it, but one of them is that it doesn't assess sexual identity among people who are under the age of 18. So these analyses were restricted to those who were 18 and over. And so for this, uh, across all 4 years, sorry, I'll come back. Ignore that last bullet point about the number there, because I'll come back to that for these studies. But one of the studies that I looked at was how I was given a little bit of funding from an injury center at Columbia to look at something related to injury-related outcomes. And so one of the things that was on the list was DUI disparities. And so using this NISDO, I examined with some colleagues at Columbia disparities in DUI-related behaviors at the intersection of sexual identity, gender, and race and ethnicity. Um, Coming back to this measure, the way that the NISDO measures sexual identity is asking people what they consider themselves to be, and they give them the response options of either heterosexual and that is straight, gay or bisexual, or gay or lesbian, bisexual, don't know, or they could refuse to answer. And for these studies, I excluded people who indicated they didn't know or who refused to answer. The NISDO also follows the census data categories for race and ethnicity, and then collapses them into distinct groups with white non-Hispanic, black non-Hispanic, Hispanic, and then there's for these analyses I had to collapse the remaining racial ethnic groups into just one other non-Hispanic group. Gender is probably one of the is for sure one of the more challenging and problematic variables within the NISDO data set because gender I think just recently they were changing this variable, but I believe I don't, given what's been going on, I don't think I maybe we won't even ask gender at all. But but from the 2015 to 2019 data, gender was determined by asking an interviewer to record whether the gender of the person they were talking to was either a man or a woman. So those were the only two options available, and also the fact that the interviewer is recording whether or not somebody, what somebody's gender is, as we all know, problematic. So just highlighting that extreme limitation from the beginning. But so for this paper, looking at DUI rates or the prevalence of DUI, and so we asked participants, or the NISDO asked participants if they used alcohol or marijuana in the past year. And among those who used those substances, they asked if they had driven in a vehicle while under the influence of that substance within the past year. Yeah, just to say, sexual identity wasn't added into the NISDO until 2015. DUI measures were changed in 2016. So I used data, the 2016 to 2019 data for these analyses, which resulted in a unweighted sample of 165,590 adults, and conducted logistic regression models to estimate with interactions across for gender, sexual identity, and race ethnicity. Um, Logistic regressions modeling those interactions and the direct effects on past year DUIs, and then use those estimates to calculate predicted probabilities of DUI for each subgroup. And so you can see here, this is the predicted probabilities of each subgroup in terms of past year DUI, driving under the influence of alcohol. And you can see that there are some pretty significant disparities here, particularly for sexual minority women, that And so I think this is really interesting that if you look at the difference, like if you just looked at odds ratios, some of these odds ratios for women, for sexual minority women compared to their heterosexual counterparts are pretty large. However, and so I think that's important. I think that's really important data. But I also think it's important to look at them compared to like the rest of the population, because when we're talking about, and I struggle with this whenever I'm writing about things like substance use, because these are highly stigmatized behaviors. I mean, DUIs are obviously highly stigmatized, and there's a lot of public concern around the rates of DUIs in their communities, and so finding a way to talk about these things as this is a thing, this is an area that needs our attention, and this is a community that needs intervention without saying this is like a bad community that, or like further stigmatizing the community. It's a delicate balance. And so it's interesting. I find it important to point out that while compared to like heterosexual women within the same race that and ethnicity, sexual minority women have much higher prevalences of DUI, significantly higher prevalences of DUI. But when we compare those to their male counterparts, right, they're women typically, a lot of these women are still have lower prevalences of DUI compared to their male counterparts. And so I just think it's interesting how we can do these different types of comparisons and see, get kind of a sense of what impact sexual identity might have on DUI prevalence, or what impact gender might have, and then also get a more nuanced understanding of like within these specific kind of communities of what do these behaviors actually look like. And so in general, you can see though that sexual minority women were significantly more affected by DUI alcohol compared to their heterosexual counterparts. In terms of cannabis, we can see in general that past year DUI of cannabis is higher than DUI alcohol for the general population, or I guess not for the general population, among people who use cannabis. This is among people who use cannabis. So um, people this suggests that people who think the public perception is that it's less risky to drive under the influence of cannabis than it is to drive under the influence of alcohol. Um, but we still see that bisexual women, as well as white and Hispanic bisexual men, had significantly higher prevalence of DUI cannabis compared to their heterosexual counterparts. Um, just kind of the points from this is that sexual minority women, especially those from Hispanic, Black, and other racial ethnic groups, face a significantly higher risk of DUI compared to their heterosexual counterparts. The likelihood of DUI among sexual minority men varies widely across different groups, with some showing higher risk and others showing similar risk to their heterosexual counterparts. And I think this was a big part because this paper was recently published. And I think one of the things that I really tried to drive home was that most DUI, and was interesting to me as I was doing the reviewing literature, is that most DUI interventions, like prevention interventions, were developed or with the target being white heterosexual men. So, where are they most likely to drink? Where are they most likely to drink and drive? And so there is really a lack, I mean, a real literature gap in terms of what types of interventions are needed to support sexual minority women in reducing their risk of driving while intoxicated or driving under the influence. And there are all kinds of other questions I think that this opens up in terms of what what is it about? It's fun to sit around with my colleagues and hypothesize about like whether or not, like, is there something about where certain communities go to drink in terms of how far it is away from their home or where they, and like, can you walk to your local gay bar? Can you not? Do you need to drive to get there? And so having access to maybe some of these spaces, and it would be interesting at some point to look at uh, just kind of how close do they live to spaces where they can socialize and maybe even in drink or use cannabis and not put themselves at risk of DUI. So I already mentioned some of these limitations of this first study is that about the questions. Also, there's with DUI and sexual identity, there's always the possibility of social desirability bias. And these uh, didn't the data that I from the NIST didn't capture DUI frequency or perceived level of impairment, which I think are important future directions. And of course, the sexual identity measures and gender measures and omitted a number of other identities that people may or that people possess. And so we don't really know what DUI looks like in those communities. And the second piece that I was going to talk about was just using kind of the same statistical approach and using the same data set. I was interested in looking at just differences in drug or workplace drug policies. And so same measures in terms of sexual identity, race, ethnicity, and gender. But our outcomes in this study were looking at whether or not the individual worked at a place that had a written policy regarding alcohol or drug use. What did their workplace test for alcohol or drugs? Was alcohol or drug testing part of the hiring process, or was it random testing? And what happens if a person violates or like has a positive alcohol or drug test? What happens on that first offense? And for that last variable, we just basically dichotomize the variable to say, like, does the policy call for that person to be terminated after the first offense, or are there some other less aggressive kind of interventions, or actually more supportive interventions than just firing on the first offense? Um, and so these analyses were just restricted to people who had employment. And I was able to use all data from 2015 to 2019. So we had 143,000 about adults and using the same statistical approach. And so when you look at this here, this is the results of whether or not individual worked at a place that had alcohol or drug testing. And when you can see here that actually most, in general, sexual minority men were less likely compared to their heterosexual counterparts to work at places that had an alcohol or drug policy. And I think this is interesting because it kind of speaks to, there's the literature on norms and acceptability around substance use within some of these communities. And so it was interesting to see that sexual minority men were not working at places, were less likely to work at places that had these types of policies. Among those that had uh, uh, I'm sorry, I said policies, but what I meant was drug testing, like specific drug testing. So yeah, they were less likely to work at places that required some sort of alcohol or drug testing. And then among those that required alcohol or drug testing, we see that some sexual minor or gay men, white and Hispanic gay men, and white, Hispanic, and other racially identified lesbian, or I mean, sorry, that was sexual women were less likely than their heterosexual counterparts to work at a place that required drug or alcohol testing as a condition for hiring. But in terms of random testing, the results were pretty similar to the first, just whether or not there was alcohol or drug testing, with sexual minority men generally being less likely to work at places that had random alcohol or drug testing. Um, and it's interesting to think about like just whether or not this is like how alcohol and drug testing might be related to um, the types of jobs that people have access to or the types of jobs that they might have. Um, the last one, and I think this is the most probably interesting finding, is this is looking at how whether or not somebody's most likely to be work at a place where they would be fired on their first offense. And because I think this is one of the most like one of the biggest structural barriers um, uh, in terms of, I guess, uh, consequences related to drug use. And we see here that for white, black, and other racially identified sexual minority women, that they were significantly more likely compared to their heterosexual counterparts to work at places where they would be fired if they showed up with a positive alcohol or drug uh, test result. And with lesbian Hispanic women are actually being the most likely to work at a place that had that type of policy. And so I think this is, interesting given, the challenges that women face in the workplace, the challenges that queer women face in the workplace, and the fact that this would suggest that they're working at less tolerant places or less supportive places. And if they were to encounter an issue related to like a alcohol use disorder, or they were to have a drug use disorder, that they would just have a lot more instability because their job security would be a lot more, uh, would be in greater jeopardy. So yeah, so just to summarize that, in general, sexual minority groups were equally or less likely to work at places with alcohol or drug testing compared to their heterosexual counterparts. However, bisexual women and Hispanic lesbian women were more likely to work at places where they would be fired after their first alcohol or drug offense. And these results highlight the necessity for intersectional approaches understanding uh, uh, to tackling drug use stigma at the structural level, as well as promoting equitable workplace practices. Same kind of limitations here as the first study. But I think overall, these really emphasize a need as well as a benefit to taking intersectional approaches in research as well as program development, to understanding how the consequences of alcohol and drug use might not be evenly distributed. And particularly for Black and Hispanic sexual minority women who may experience multiple converging forms of oppression and marginalization, that understanding and intervening to support them and reduce the effect of alcohol and drug use on their lives is critical and important. So, and I'll wrap it up here in a second, is that although I've now just been talking a lot of time harping about how we need to do more for sexual minority women, which is not so, is something that I am is on my like radar for as far as I think about like the directions of my research. I do just want to highlight briefly what I do have currently going on, which focuses on Hispanic and Latino sexual minority men. And really, the goal of my current research is to look at how intersectional stigma, focusing on sexual minority stigma and drug use stigma, how they come together to influence methamphetamine use as well as the use of other drugs, and HIV vulnerability. And so, just briefly, right now where I'm at is doing the first aim of my study, which is looking at state level alcohol and drug policies, as well as sexual and gender minority stigma policies and laws, to see how they converge to influence HIV and drug use outcomes in this in an existing data set that I have from a colleague at CUNY. And so right now we've been collecting a lot of these aggregating a lot of these laws and policies across the states and getting ready to start running our analyses here. And then the next piece is just is to do an egocentric network study to see how stigma manifests within social support networks, how it over time, how that stigma changes is either whether through network composition or through changes uh, within like specific network members. And then to see how those stigmatizing experiences shape HIV and drug use behaviors through things like emotion regulation, types and qualities of social support, as well as the internalization of stigma. And yeah, so that's the next phase of this. And the last piece is where I'll also be looking at some enhanced biological vulnerability to understand how certain communities might look behaviorally similar, but might not be as equally susceptible to certain types of infection, including HIV or other inflammatory related outcomes as a result of methamphetamine use. So that's the kind of folded into the social network study or the ecocentric network study. So yeah, and hopefully all this will lead to an intervention. And in collaboration, my plan is to take it back to the participants and say, here's what we found, and here's what we're thinking about intervening upon. What do you think? And yeah, that's where I'm at right now. So thanks for listening.